Okay, first, I want to welcome Peggy. She's originally from Malaysia, living in Jakarta. Fall in love with Indonesia in Jakarta, right?
Yes, yeah. I've been here for about 4 years and really enjoying it.
Yeah, I really like Jakarta as well. I love Indonesia. I really miss it. I hope soon we will be able to travel. Soon means next year or somewhere around that. But okay,
Yeah,
so the Peggy is a biotherapist, and she's since the very beginning she showed a lot of enthusiasm, which I really appreciate. So thank you very much for that. So we spoke recently, and then you mentioned something interestingly that you treated around 20 people who suffered from some kind of complications due to the SARS-2 CoV infection, which means with the patients who had a COVID-19. So this is very important to understand that there is no cure in our case, and that we can support healing by this by therapy, by this amazing methodology. And in from our perspective, this is actually a viral infection with the side effects or with some kind of comorbidities. So, what is your experience?
Oh yeah, I started treating COVID I think since March this year, and mostly the patients in Indonesia. As you know, in Indonesia, I think up to now they have around 4,000 cases per day. A lot of them recover, but in the beginning, I think the death rate was quite high, and also the doctors also got infected, and quite a number also died. And I treated like five doctors because I think a couple of doctors got infected and they contacted me, and then one thing lead to another because they also referred their friends to me. I think the first case I treated is all via distance healing, distance therapy. So the first case I treated was a case in Papua in Indonesia.
Interesting.
uh, yeah, and it was a case of a family with COVID, and I have never tried treating COVID, but they have all the classical symptoms like the dry cough, the difficulty in breathing, and everything else. And I've treated the three in the family, and they did not seek the doctor. They did not go to the hospital because at that time there was not a lot of information about the COVID. I think it was way back in March, but they exhibited all the symptoms of COVID, and they will have difficulty breathing and the dry cough, and it got really bad because they couldn't breathe. And so I treated them for about 3 days, and they got better. They
Okay.
they got better, and it was quite surprising, but I followed the treatment protocol for biotherapy. Treating all the symptoms, especially the one if they are breathing, they have difficulty breathing and the coughing. Then I will treat the lungs as well.
Pneumonia.
Yeah,
Pneumonia.
yeah,
Yeah.
yeah. The pneumonia, and some other symptoms because they usually get very panicky. They got very frightened and they have difficulty breathing. So I also treated them on that one using the biotherapy.
I wanted to ask you, since there is a lot of unknown things with COVID, and we are still learning about it. It's obviously a virus which has very new characteristics, and it's much more severe, and it's easier to be transmitted. And I guess it's going to take time until we fully understand how to cope with it. And of course, we have to wait for the vaccine. But these kind of treatments are very, especially when it's a distant, they're very useful in this case because you cannot be in a direct contact with the patient. It's obvious
Yeah,
you will
yeah,
get the
yeah,
virus.
yeah,
So when you propose distant therapy, how
yeah.
people react, because it's very unusual for people to even think in that manner, although we are doing it on a daily basis, so it's a normal thing for us. So how people react?
Well, I treated quite a number of doctors and all the other people. I think they didn't question it because they were very frightened. So they have no choice. They felt that they have no choice. So they never questioned whether it's going to work or not. But surprisingly, it did work. All the cases I've treated worked, and and they turn negative, you know.
Yes,
So it works. Whether you believe it or not, just I just treat and I do not diagnose.
yes.
So that's the most important thing. Yeah.
And what is interesting, I guess that okay, this is not something we can display because it's a private information, but I guess that if you do the diagnostics before and after the treatment, I guess that you can have reliable objective biomedical data, maybe to see in a response of the immune system. Maybe there is a bigger response which is measurable by the antibodies, or there is a less inflammation of the lungs, or there is more oxygen in the blood. I guess you can see these results in that manner, right?
Yes, because I have treated, recently quite a number of patients COVID with complications. So they're already on oxygen. So once we treat them, actually they got better and better. And at some point in time, they actually have take off the oxygen. So
Ah,
they're off oxygen. And then, of course, the proof of it is also the test, that they have done negative again.
negative again, yeah.
Yeah, yeah.
Uh, I wanted to ask you because I remember we spoke in the last few months about some unusuality in treatments. What was your unusual case? Do you have some kind of cases that you would like to share a little bit more? Something that was unusual even for you and for the patient?
Well, I think it's the symptoms vary. There are people who actually have very light symptoms. They have a loss of sense of smell, or they have diarrhea, they have a bit of cough. And usually, if you treat these people early, sometimes they have already taken a COVID test. They're waiting for the test. So they ask for the treatment. So when I started the treatment and finished the treatment, um, then they tested positive for COVID and they have to go to the hospital. But by then, the severity of the symptoms has mostly gone, and they're just waiting for the test to turn negative. But the challenging cases that I've treated is those that they are in the HCU, in the ICU, and they are on oxygen. Those are the really cases that you get very worried, because you look that you can see that they are really like looking very bad, you know. So
Of
those
course,
are the
they're
case.
scared and they cannot
Yeah,
breathe.
yes. Most cases that I've seen is those cases that they don't need to be on oxygen, but the most challenging cases are those that are on oxygen. And the one of the common features are all of them have some pre-existing condition.
Mm,
You know,
yes.
they have some pre-existing condition. I think one case that she went for surgery. She may have caught it in a hospital, and she's a doctor, and then she was in ICU for quite a long time. There was another case with diabetes. He's also a doctor. He had diabetes, and then it took him almost like uh, I think 1 month or more than 1 month, to get off the oxygen. And also because of the pre-existing condition, it has some problem with the kidney failure, and reduce kidney function and things like that, which I need to also treat for that.
Yes.
Yeah, but I'm quite glad that all of them actually recover. So which is very amazing for this treatment, because this is probably the first time I've treated so many COVID cases.
Well, this is if you remember, we spoke during the education. We actually mentioned this many times. The thing
Yeah.
is that with any kind of treatment, if you want to have result, or if you want to have a statistically significant result, you have to treat a lots of patients, a lots of people. So for that reason, it's good to make this available for more people. This is one reason. Second reason is that people will benefit from it. So I wanted to ask you from your personal experience now. Do you think, for example, that this very treatment could be actually adapted to the hospital environment where the nurses actually can do it? What do you think about it?
Yeah, I think that is a very good idea because I've also thought about it before, especially in Indonesia, where there are many nurses and doctors who get infected. They uh, they can have a team within the hospital to treat these patients who are in isolation for COVID and things like that, but they do it on the video call or something with the
Yes.
patients. That
Yeah.
could actually help. I think one thing that I did when I did the distance therapy is I made them all do video call, because if you don't do video call, maybe they are really skeptical. So
They
I
don't
did
have feeling of therapy. Yeah. Yeah.
yeah, just to support them as well and to have a look at the condition. So by visually, I can actually see the condition gets better and better over time as you progress with the therapy.
Great. This is uh, this is a good approach. Okay. I wanted to ask you just one more thing, because now you have a very valuable experience. What would you suggest to other therapists? How to approach the work, and sometimes we say, "Oh, this is a COVID. This must be something incurable. It's very hard to treat." So the way how you approach, what was your approach, and what would you suggest to our colleagues how to approach not just COVID but other chronic and severe diseases to overcome the fear and so on?
Uh, well, I think I follow the treatment protocol, as you know. Depending on the symptoms, I first like interview the patient, and I ask them about all their symptoms and things like that. And from there, I just follow the treatment protocol, and just be consistent with the therapy. Because, for example, I think recently I treated a case. I think I've been treating this patient for about 5 6 months. I think it was like a small girl, about 3 years old, a small
Oh,
child, and she had cancer in the eye, and then was going through chemotherapy. So the parent will take me, have the treatment. She will be very consistent. Every 3 weeks or 1 month, she will ask for the treatment. So we continue the treatment regardless whether there's any result. But off and on, she will give me the CT scan of the eye and things like that. And I think the most recent treatment after most recently, the tumor has disappeared, but it took like 6 months. So it's being consistent with the treatment, you know.
yeah, that's
Uh,
important. That's
yeah, for it
very
to work.
Yeah. It's
Yeah.
sometimes it's hard. I guess you have the same experience for the therapist to wait, also for the family and for the patient to wait. But actually, it's really true that in many cases, especially with chronic diseases, you need to be persistent and you have to have will, and how to say, you have to do it from month to month and be patient, actually, and to give hope to the patient, and then you will have a result. It's not because you are persistent, but because the immune system really needs sometimes a little bit more of stimulation to really get there, to get to the point of healing.
Yeah, I think that's a very interesting thing that you brought up, because all my COVID patients, they are very impatient for the results, and I tell
Oh,
them I'm not doing anything magic. It's very scientific, and it's what I'm doing is I'm working on the immune system. So for the it's the body, how long the body takes to recover,
yes.
because we are working with the immune system. So it's just explaining to them so that they can understand that this is not something funny. It's very scientific, and we are working with the immune system, and it's their body that's healing.
Yes. What is interesting also is about this period, since we are talking about the immunity and how the immune system is essential for the all of the healing, not just to protect from the pathogens. I think that this period where the general audience worldwide is actually informed from the scientific point of view how the healing works, actually help also promote our work. So let's say that we can find in this very bad situation for many people, they lost their loving ones. But also this situation taught us that we have to take care more of the nature and the way how we cooperate with the nature. And also it actually educated people in medicine. Now it's clear that the immune system is the king of all of the healing. So if we strengthen our immune system, which is possible, there is a lot of resources on the internet, so people who are interested, they will find a way how to access the information. We know that actually we can defend from most of the diseases by maintaining our own defenses, and biotherapy with a good therapist like you can actually make that happen faster, or make that happen in a cases when it's evolutionary, it's not possible. And so we are some kind of catalyzer of the immune response.
Yeah, I totally agree with you on that. Yeah.
Okay. Thank you very much, Peggy, for this interview. I know that it was hard for all of us. So yeah, just keep the good job. I really appreciate the how you approach the work, and yeah, I'm really happy to have you as a friend and as a colleague. Thank you very much.
Yeah. Thanks a lot, Ivan. Yeah.
Thank you.
Stay safe. Okay.
Yeah,
Bye.
stay safe and keep in touch.
Yeah.
Really hope
Yeah.
so. See you soon in Jakarta.
Yeah. See you soon.
Okay.
Bye.
Bye bye.
Bye. Bye.